अच्छा जी, पाकिस्तान दुनिया के ऐसे मुल्कों में शामिल है जहां तंबाकू इस्तेमाल करने वाले लाखों में नहीं करोड़ों में हैं और जिसमें सिगरेट्स, पान, नस्वार, गुटखा ये सब कुछ आम है। लेकिन वहीं दुनिया के तरक्की याफ्ता ममालिक जिनमें अमेरिका, स्वीडन, न्यूजीलैंड, जापान वगैरह शामिल हैं, वो तंबाकू नोशी से छुटकारा हासिल कर रहे हैं, बिल्कुल कोशिश कर रहे हैं। और ये कैसे मुमकिन हो रहा है, इस हवाले से ब्रिटिश अमेरिकन टबैको ने एक स्टडी भी पेश की है और इसमें क्या कहा गया है और पाकिस्तान जैसे ममालिक इस स्टडी से कैसे फ़ायदा उठा सकते हैं, इस मौजू पर बात करने के लिए डॉक्टर समर हैना हमारे साथ मौजूद हैं, जो कि ब्रिटिश अमेरिकन टबैको में साइंटिफिक रेगुलेशन की सरबराह भी हैं। डॉक्टर समर, थैंक यू सो मच फॉर जॉइनिंग अस दिस मॉर्निंग। हाउ आर यू डूइंग?
So much for having me.
Great. Dr. Samar, we have a lot of questions for you. We are impressed by these different countries that we just mentioned who have been able to get rid of cigarette smoking to a large extent, and obviously we would like to emulate those models as well. But first up, what brings you to Pakistan?
So what brings me here to Pakistan today is to really start a dialogue on tobacco harm reduction. BAT is doing that today through the introduction and launch of what we call the 𝐏𝐸𝐬𝐬. That's a compilation of the last 10 years of third-party and industry science on what we refer to as reduced risk nicotine products. And we think that there's not a better place to have this conversation than Pakistan. This will be the first time that we're doing this outside of London, so we're very, very excited to be here. But with the 𝐏𝐸𝐬𝐬, what we have, as I said, is 10 years of research, really looking across over 80 markets, coming together in over 200 industry publications, and these are peer-reviewed scientific articles, and over 600 independent publications that substantiate that tobacco harm reduction is an opportunity to move people away from cigarette smoking.
Could you elaborate a little bit more on tobacco harm reduction, because it sounds very attractive, and with the millions of people smoking in Pakistan and using other tobacco products, we definitely need something like this.
Absolutely. So when I refer to tobacco harm reduction, what I'm really talking about is the opportunity to minimize the harms associated with cigarette smoking. So for those people who are not interested in quitting smoking, what we think is important from a public health opportunity is to give them the option of reduced risk products. So if you think about the harms associated with cigarette smoking, what we're talking about primarily is the burning of tobacco. So removing that burning while still having a nicotine product that adults can use.
Would that include things like vapes?
I'm sorry?
Would that include things like, you know, vaping is very popular these days.
Yes.
Would you include that in tobacco harm reduction?
Yes, so we would include that in things like vapes and also oral nicotine pouches. So those are the small sachets of non-tobacco nicotine. And with 25 million smokers in Pakistan, having these products on the market we think is a very important public health opportunity. We know that in the last 5 years in Pakistan we've had both the nicotine pouches and vapes and have over about 500,000 people using those products. And that's really important because when you think about something like nicotine pouches, you're talking about a product with over 99% reduced toxicity compared to a cigarette. And we know, based on other countries such as Sweden, which you mentioned earlier, that when you introduce these kinds of products into a country with the right kind of regulations and the right access to adult consumers, that you see the public health impacts in a really profound way in terms of things like cancer and other smoking associated diseases.
Dr. Samar, I'm going to stop you there and I'm going to translate this for our Urdu speaking viewers a little bit. Please bear with me. 25 मिलियन स्मोकर्स हैं पाकिस्तान में, मतलब इनका ये कहना है। ऑब्वियसली उनको बात सारी ये है कि उनको ऐसे मुतबादिल, ऐसे अल्टरनेटिव दिए जाएं जहां वो अगर बिल्कुल ही क्योंकि एक एडिक्शन है स्मोकिंग, नहीं छोड़ सकते, तो उसके अलावा और बड़ी चीज़ें जो उनकी मदद करेंगी छोड़ने में, तो उसमें बहुत सी हैं, जैसे निकोटीन पैचेस एक बहुत हैं जिसमें आपको वही आराम, वो जो आप चाहते हैं, वो जो एक सेंस होती है स्मोकिंग से आपको मिले, लेकिन उसके हार्मफुल जो हैं वो इफ़ेक्ट्स नहीं होंगे। बहुत से मुल्कों में इन्होंने रिसर्चेस किए हैं, बहुत से ऐसे ममालिक हैं जिन्होंने अपने पूरे स्केल्स जो हैं वो ओवरटर्न कर लिए हैं, जो बहुत ज़्यादा जहाँ स्मोकिंग होती थी और अब वो बहुत कम हो गई है। सो सक्सेसफुल मॉडल्स बहुत हैं और ये चाहते ये हैं कि पाकिस्तान में भी वो अल्टरनेटिव्स मुतबादिल जो हैं वो लाए जाएं, ताकि लोगों के पास एक चॉइस हो कि वो क्या करना चाहते हैं और क्या नहीं करना चाहते। फ़िलहाल तो आपको कोई चॉइस भी यहाँ ऐसा नज़र नहीं आती। डॉक्टर समर, व्हाट इज़ द omni significance to Pakistan and how do you plan on going on about it over here?
Absolutely. As I mentioned, Pakistan's incredibly important in terms of the omni and also the conversation we want to have around tobacco harm reduction. If you look through the compilation of evidence there, Pakistan is actually featured as a model of what the public health opportunity is for reduced risk nicotine products. What we think is really important within that is the opportunity, as I said, to have that dialogue, to really come together in terms of science-based public policy. There was a team of researchers recently who actually published a study that indicated that with the policies of the World Health Organization and the Framework Convention on Tobacco Control, if you combine that regulatory proposals with tobacco harm reduction elements, that you could actually save 1.2 additional million lives in Pakistan through the recognition of tobacco harm reduction. And so with the Omni having that conversation here, bringing that kind of evidence to people, we think is just such an important opportunity, and we're really very excited about sharing this here in Islamabad tonight.
Dr. Samar, I'm going to ask you a few questions because when we Pakistanis read a lot of different researches, some papers, or generally on social media, there is a sense that a lot of these alternatives are more dangerous than smoking itself. Is there any truth to it, and how do you counter it?
Absolutely. So what we think is really important in this conversation with tobacco harm reduction, and the easiest way to think about it, is the harms associated with cigarette smoking. It's really about burning and not burning. So when you have a cigarette, you have the thousands of chemicals that a smoker is exposed through the burning of tobacco. And when you talk about reduced risk nicotine products such as vapes and oral nicotine pouches, you're talking about removing the burning, which is really what's associated with pouches, the 99% reduction in the toxicants that a person's exposed to. And so taking that burning away is what creates that reduced risk profile for those products. And so when you think about it just in those terms, I think the evidence is quite compelling that these products provide both a satisfying alternative for smokers, but also one that is significantly less risky than tobacco smoke.
Thank you so much, Dr. Samar Hana, for being in Pakistan, for doing what you're doing, and we hope and wish that we, Pakistanis have more alternatives, ताकि जो छोड़ना चाह रहे हैं, और ये एक स्ट्रगल है, जो बहुत सालों से स्मोकिंग कर रहे हो वो छोड़ना चाहें और उनको पता भी हो कि कितने रिस्क्स हैं, तो उनके लिए कोई अल्टरनेटिव्स तो होने चाहिए। और एक बहुत बड़ा इसी चीज़ से आप तयन कर लें कि क्या बेहतर है और क्या नहीं है। जिस तरह डॉक्टर समर भी कह रही थी, जो चीज़ बर्न कर रही होगी, जो जल रही होगी, वो ख़राब है आपके लिए, तो लिहाजा उसका कोई अल्टरनेटिव होगा, पैचेस वगैरह कुछ भी होगा, वो बेहतर होगा। एटलीस्ट वो चीज़ जल नहीं रही होगी, आग नहीं लगी होगी उसमें। तो ये भी एक वन गुड वे ऑफ सीइंग के क्या बेहतर है क्या नहीं।